Could a playful kitten really cause a rare and dangerous infection in humans? Imagine a simple scratch leading to a bone infection that almost stumped doctors, until one small detail changed everything. Let's explore a fascinating case that highlights how something as innocent as cuddling your pet could have surprising consequences. Welcome back, NotSoTechie family. Today, we're diving into the intersection of pets, bacteria, and rare infections. This incredible story involves a teenage girl, her kitten, and a diagnosis that even had doctors scratching their heads, pun intended. If you're new, please subscribe and turn on notifications to catch the latest interesting science stories from technology and medicine. Now, let's jump right in. The start of a medical mystery. It all began when a teenage girl from Portugal was taken to the hospital with severe pain in her lower right abdomen and a lasting fever. Doctors ran some basic tests, but they couldn't find anything that immediately explained her symptoms. No recent travel history, no signs of exposure to unusual environments, and, at least at first, no mention of pets. With little to go on, the team ordered imaging scans, which revealed a shocking result: an abscess near the girl's spine, along with early signs of bone erosion. This discovery raised serious concerns, as it suggested the presence of an invasive infection. Did you know? An abscess is essentially a pocket of pus that the body creates to contain an infection. These infections can spread rapidly if not treated, especially in critical areas like the spine or bones. At this point, doctors knew they were dealing with something far more complicated than a routine bacterial infection. The plot thickens, the search for a cause. Doctors initially tested the abscess for common bacterial pathogens, but the results came back negative. This was troubling because it meant the infection might involve a more elusive or uncommon microorganism. To find answers, the team performed a more detailed CT scan and extracted a sample from the abscess. When the lab results came in, they pointed to something unexpected: the presence of Bartonella henselae, a bacterium known to cause cat scratch disease, CSD. This finding left the doctors puzzled since the family had initially denied any recent animal contact. But then, in a crucial moment, the girl's parents remembered that they had briefly owned a kitten a few weeks earlier. Mystery solved. The bacteria likely came from a playful interaction with the cat, leading to an unusual and severe infection. What is cat scratch disease? Cat scratch disease is usually caused by Bartonella henselae, a bacterium found in the saliva of infected cats. It spreads through scratches, bites, or even licking, especially when animals groom themselves or each other. Normally, CSD isn't a big deal. Most people experience only mild symptoms like swollen lymph nodes, fever, or a rash. However, in rare cases, the infection can escalate to more serious conditions like neuroretinitis, eye inflammation, or osteomyelitis, bone infection, as it did in this case. Interesting fact: cats often carry the bacterium without showing any symptoms, especially kittens who may have been exposed to fleas, another carrier of Bartonella bacteria. CSD's ability to hide within human cells makes it tricky to detect. Much like viruses, the bacteria evade the immune system, making diagnosis difficult unless doctors know what to look for. A rare and dangerous complication: osteomyelitis. The girl's case was particularly rare because the infection spread to her bones, resulting in a condition called osteomyelitis. This occurs when bacteria infiltrate the bone tissue, causing pain, swelling, and, if left untreated, permanent damage. In most CSD cases, only 0.17% to 0.27% progress to osteomyelitis. This complication made the case an outlier, something most doctors don't expect to see with a Bartonella infection. Did you know? Osteomyelitis can be life-threatening if not treated quickly, potentially leading to bone death and sepsis, a dangerous systemic infection. Diagnosis and treatment challenges. Once doctors identified the bacteria, the next challenge was treatment. Bartonella infections are hard to treat because the bacteria live inside cells, making it difficult for antibiotics to target them. In this case, doctors prescribed doxycycline and rifampicin, two powerful antibiotics often used to treat stubborn intracellular infections. The girl's recovery was remarkable. With proper medication, her symptoms subsided, and follow-up tests confirmed that the infection was under control. However, the doctors emphasized that early intervention was critical. If the infection had gone undiagnosed, it could have led to permanent spinal damage or worse. Doctors note, cat scratch disease can be difficult to diagnose when typical symptoms are absent. If common infections are ruled out, it's essential to consider Bartonella in the differential diagnosis, the medical team noted. Lessons from this case. What pet owners need to know. This case is a valuable reminder for pet owners, especially those with kittens or young animals. While the chances of developing a severe infection from a pet are very low, it's important to practice good hygiene. Here are a few tips. Wash scratches and bites immediately with soap and water. Keep cats flea-free to reduce the risk of infection. Monitor children and pets closely to avoid rough play that could lead to accidental scratches or bites. If you experience unusual symptoms like fever or swelling after a scratch, see a doctor immediately. The good news: recovery and caution. Despite the initial scare, the girl made a full recovery. Her story underscores the importance of early diagnosis and treatment when dealing with uncommon infections. It also highlights the close connection between humans and animals, demonstrating that while pets bring joy and companionship, they also require responsibility and care. As technology and medicine advance, new treatments will continue to emerge for diseases like CSD, ensuring even better outcomes in the future. But for now, it's crucial to stay aware and informed about the risks, even those that come with the cutest companions. Conclusion: science, pets, and preparedness. So, what's the takeaway from this fascinating case? Pets are wonderful, but they come with their own set of risks. Knowing how to respond when things go wrong, like in this rare case of a kitten-induced bone infection, can make all the difference. As always, thank you for watching. If you found this video interesting, hit the like button, share your thoughts in the comments, and don't forget to subscribe for more intriguing science and tech stories. Stay curious, stay cautious, and keep enjoying the wonders of the world around you.